Hi, my name is Tania Bubela and I'm the Dean of the Faculty of Health Sciences, and I'd like to welcome you back to this term of in-person instruction. But COVID-19 is still with us, so I have prepared a short presentation just to think about safety and what this term is going to look like so that we can all enjoy it together. Welcome back to in-person instruction in the Faculty of Health Sciences at Simon Fraser University. Please have patience with your classmates, instructors, SFU staff members, and teaching assistants who have different levels of anxiety about the current COVID-19 situation. Show respect by abiding by provincial and SFU public health measures. The restrictions are made by the Provincial Health Officer under the Public Health Act and can be found at the link on the slide. Note that these may change over time, so stay current about how they are being implemented at SFU by checking the Return to Campus webpage regularly. Now, as health sciences students, you are learning or you will learn about the importance of evidence. The nature of scientific inquiry means that evidence may change over time, and this is normal. For example, see the work of the COVID-19 modeling group pictured on the slide that includes researchers from SFU. And as you can see from this graph, COVID-19 cases continue to increase, but the rate of increase is slowing. So changes in cases means that we need to adapt our public health measures. But it is important to keep in mind that evidence is not the only thing accounted for by public health officials. You need to balance science and societal and political interests. So whose and what evidence? Alongside the COVID-19 pandemic, the World Health Organization has identified an infodemic. This is the spread of mis and disinformation on social media. Misinformation is incorrect based on the best available evidence from relevant experts at the time, while disinformation is the intentional spread of false information. You are learning to judge the credibility of sources and the validity of evidence, for example, study design and sample size. And to help in that endeavor, we have Science Up First, which is a Canadian initiative that helps vet information. And you can be part of that initiative by signing up on the webpage on the slide if you're interested. Now, the current increase in cases is being driven by variants of concern. And in British Columbia, the Delta variant is now the dominant strain. According to the CDC, the Delta variant causes more infections and spreads faster than earlier forms of the virus that cause COVID-19. It's up to 2 times as infectious as the original and up to 60% more transmissible. And it might cause more severe illness than previous strains in unvaccinated people. New variants continue to emerge around the world, which reminds us that we need to advocate for global access to vaccines. Because vaccines are the most effective method we have to protect ourselves and others from infection or severe disease. And the vaccines that we have available in Canada are safe and highly effective, including against the Delta variant. Now, BC CDC data show that most cases and hospitalizations continue to be among unvaccinated individuals. Based on last week's data, compared with fully vaccinated individuals and taking into account age differences, unvaccinated individuals are 12 times more likely to become a case, 34 times more likely to be hospitalized, and 8 times more likely to die. A large recent international study led by researchers at King's College London similarly found that people who experience breakthrough infections of the coronavirus after being fully vaccinated are about 50% less likely to experience long COVID than are unvaccinated people who catch the virus. And it also provided further evidence that the 2-shot Pfizer, BioNTech, Moderna, and AstraZeneca vaccines offer powerful protection against symptomatic and severe disease. Proof of vaccination is therefore going to be required to participate in many SFU events and activities. So get vaccinated and encourage your friends and family to do the same. And I've provided the link to this study that's led by King's College London researchers and out of the UK. It was published in the Lancet Infectious Diseases. Now, Breakthrough infections, while rare, may still occur. So while vaccinated people have a lower viral load and are infectious for shorter periods, if a breakthrough infection occurs, they may infect others. And this means that other public health measures continue to be important. So what are some of those other measures? Well, masks. So masks help stop the spread of the virus by blocking the spray of droplets from sneezing, coughing, talking, etc. They help protect against all respiratory diseases, not just COVID-19, so influenza, for example. Masks help protect others and are a sign of respect, that you respect the health of others. Masks need to cover both the nose and the mouth to be effective, and masks will be mandatory in all indoor spaces at SFU. And if you click on the link or you go to the link, the BC CDC has provided very useful information on how to wear your mask and how to take care of it so that it is in fact effective. So other health measures include hygiene. So wash your hands to protect against COVID-19 and other infectious diseases. Social distance when it's possible. Go outside with your friends. We know that the virus doesn't spread as easily in the great outdoors. But just in case, keep track of those you come in contact with. And these are some information on this link page, also from BC CDC, about how to manage social interactions and keep track of those. So use the self-assessment app daily. This is the Thrive Health app that is part and endorsed by the province. If you show any symptoms of COVID-19 or you're exposed to it, quarantine and do not come to class. And there's some information from the BC CDC on this link on how to self-isolate and self-monitor. And of course, your instructors have been asked to be flexible in supporting you in these circumstances if you are infected or suspect that you have been infected by COVID-19. So there are those who cannot be vaccinated, choose not to be vaccinated, or choose not to disclose their vaccination status. And for these individuals, there'll be regular rapid testing put into place. So follow SFU public health guidance to stay safe so that we can continue to enjoy this term together. But remember that despite our best efforts, some members of the SFU community will get COVID-19. And those who catch COVID-19 should not be stigmatized. They'll need your support. So stay understanding and kind and respect others. And hopefully we will all have a great term together in person. Thank you for your attention.